Hey, what's up, Dr. Chad? If you're suffering from some low back pain, there are a couple of movements that we can do and a couple of soft tissues we can go after to really minimize that and feed some slack into the area. A common thing that gets overlooked in low back pain is actually tension and trigger points in the abdominals, particularly the rectus abdominis, which are the abs that are right down the center of your body. And the way we can go after that is with a ball that's about this size. So this is maybe the size of a soccer ball or a volleyball, but it's just one of those aired up kids balls, right? Pretty squishy. It's got a grippy texture to it. So the idea here is that if we can kind of expand and stretch the abs and put a little pressure and input there, we can feed a lot of slack into the low back. And this is actually one of those things that really works well for people when they've got a widespread low back pain. So the grippy texture is important, and if we can use that to our advantage, we will. There's a layer of tissue just under the skin called fascia, and if we can get a grippy texture right on the skin, we can actually expand the fascia in a different way. So if you can find a grippy ball that you can get right on your skin in the privacy of your own home tucked away somewhere, then ideally the ball's gonna go skin to right on your skin, and we're gonna work from there. But the key positions here I wanna show you. You've got the rib angle. If you can kind of find the bottoms of your ribs here, creates this little pocket. The ball is actually gonna sit right in that pocket. So it's not up on your rib cage and your sternum. It's just down underneath, all right? Once you find that position, that's where you're gonna lay. So in this position, the idea is to relax over the ball and let it sink into your torso, sink into the abdomen. What you're gonna notice is a couple of things. First and foremost, it's pretty uncomfortable. There's nothing that you can damage here, so just know that this discomfort is totally okay. You just have to take it to your tolerance. And the way you do that is, how much do you use your arms to help support you up out of that position? Once you're in position and you're settled in, the goal here is 20 deep breaths. So you're gonna breathe in, and then you're gonna slowly breathe out. And as you breathe out, you're trying to sink a little further into the ball. It's gonna expand your abdominal muscles, your abdominal fascia. It's gonna get into the diaphragm a little bit, your respiratory diaphragm. And the second thing you might notice is as you sink in, you might feel your pulse on the ball. And that's from the large aorta that passes through the trunk. That's totally okay. That lets you know that you're relaxing well and sinking in. Once you've completed 20 breaths there, you're simply gonna roll yourself forwards until it's kind of right down on your belly button. And this is gonna target the pelvis side of the abdominal attachments and the lower abdominal abs and lower abdominal fascia. Same thing, you're gonna take 20 deep breaths and slowly breathe out and sink in over the ball. You may have more tenderness up top, you may have more tenderness down low. We're not gonna get too bogged down in the mechanics of it, but just know that the abdominals have a huge pain referral pattern to the low back. And so working in these areas and spending some time there is gonna help get you some relief. We'll see you later.